I would like to ask you permission to use this video for educational purpose. This is a follow-up testimonials.
Absolutely, yep.
So when was our surgery?
June 23rd of 2021.
So about a year ago.
1 year, yep.
1 year ago. Now tell me about your symptoms before the surgery.
Before that, I was having trouble walking. I was a runner, and I got to be where I couldn't run anymore. I lost feeling in my left leg completely, and a little bit in my right leg. And there was pain where I was having trouble sleeping at night. So that's why I came and seen you.
Yeah.
And before I came and seen you, I went to Twin Cities Orthopedics.
Okay.
They talked about the procedure. I wasn't comfortable with that procedure. My wife seen you on the TV.
Okay.
She said, "Why don't you come and see Dr. Abbasi?" So I did. Very comfortable with you, so that's why we, I think it was about 3 or 4 weeks later we were on the.
1 to 10, how bad was your pain before the surgery?
It was when I was exercising. It got to be about a 7 or 8.
7 or 8.
Yeah.
Now, the surgery was 1 year ago. Do you remember the surgery?
I absolutely remember the surgery. Yeah.
Okay. How long did you stay in the facility?
I was out of there, and I think it was 3 hours.
3 hours. So within
Somewhere
3
there.
hours, you were out of the facility.
Yes.
And we did a fusion. Here, this is what we did. We did a L4-5 OLLIF procedure, transkambin OLLIF procedure. We put 1 spacer and 4 screws, and here is actually a picture of what we did. And practically what we did is took the bad disc out. We put screws above and below that level that was slipping. You have a spondylolisthesis. So when did the leg pain go away?
Oh, the leg pain was gone right away.
You woke up and the leg pain was gone.
Yeah, the next day. I mean, I think it was 2 days. I started walking. The leg pain was completely gone.
But obviously, putting those big screws, each of them is about 2 inch long.
Okay.
You cannot not feel those screws. Tell me about how was the back pain?
Oh, the back pain wasn't bad. I was on the oxycodone for a couple of days, and that bothered me.
Just a couple of days?
Yeah, a couple of days, and because I couldn't take it anymore. I started to feel good at about a week. I started walking. I was walking, 1-2 miles. That was all good. There was no pain whatsoever.
In what time frame could you walk? Just a week or 2, or when did you start walking 1 mile?
Oh, I started walking 2 days later.
2 days later. Excellent.
Yeah.
Excellent.
So I mean, I wasn't going far. I was probably going a half mile to something.
Half a mile.
Yeah.
Well, half mile is more than I walk every day.
Oh, okay. Well, anyways, yeah. So that was all good, and then it got better. It just got better, and I still didn't feel 100%. And then about 4 months in, I started to get some muscle pain. So you told me to go see a physical therapist. I went there for I think about a month. That was gone. That was all good. But I really started to feel good about it. It was probably 6 months, and then I was back to
back normal.
Back to when I was 30 years old.
Yeah.
Well,
how old are you?
Yeah, I'm 64.
Okay, so well, I didn't make you younger.
No, you didn't.
But practically, the leg pain was gone right away.
Immediately.
The back pain started getting better, within few weeks.
Back pain started to get better. I mean, that pain was really gone after a week. There was nothing there after they got the incision and stuff like that. After that, there was really no pain. Just that every now and then I'd get a little bit of a setback where it hurt for 2-3 hours or something.
Was it activity related?
I think it was more activity related.
Yeah. And that's normal. Your body talking to you.
Yeah.
You just have to listen to that. Now, if you remember, let me turn around. You have another problem here. And many of my colleagues look at that and say, oh my God, spondylolisthesis, disc disease. We very consciously decided not to fix that.
Correct. Yeah.
You remember that?
Yep.
Why did we decide not to fix that?
Well, I think you said if it's not broke, don't fix it. And
it is broke,
well,
but it wasn't causing you symptoms.
Okay, that maybe that's
Yeah.
so that's why we decided not to do it that time. And today, I mean, I have no symptoms and I feel great. So
you're still not going to touch it.
Yeah.
Meaning, I fix people, not images.
Yeah. Yeah, you said that.
Yeah, and that is the problem here is that disc is gone, but nature has many ways dealing with problems. It seems your body is dealing with that just fine.
Yeah, today,
you're just going to keep watching it, and as long as it doesn't cause you any clinical symptoms, it doesn't matter how the picture look like, you're not going to fix it.
Yeah.
Now, in that sense, I hope this is the last time I see you.
Me too. Okay. Me too. I enjoy meeting with you. I'm very comfortable with you, but hopefully,
hopefully you don't see me anymore.
Yes, hopefully,
okay?
yes.
Now, tell me just about this, without telling the name of the surgeon and so on. The surgeon that you saw about his kind of surgery. What did he tell you about the recovery and so on, about the surgery itself?
Well, he didn't really get into details until I pressed him.
Okay.
And then he started to talk about how he had to cut me open in the back. He also said there's a possibility he had to cut me open in the front.
Mm-hmm.
And then kind of move when he started moving my
the
intestines,
bowel and the intestine.
that really started worrying me. And then I thought,
Yeah,
well, you know what,
yeah.
maybe I don't know what I want to do. At that time, we postponed the surgery. I was in a lot of pain, and like I said, my wife seen your advertisement on TV and said, "Go check this out."
But did he tell you about the recovery?
Yes, the
after
recovery at that
surgery?
time. He wanted me in the hospital. I think it was at least a week,
So 1 week in the hospital versus
Yes.
3 hours in the facility.
and he didn't want me to go back to work. I think it was for 2 months. I was back to work within, I think it was 7 days here.
So 2 months out of work versus 1 week out of
Yeah.
work.
Now, granted, I sit at a desk, so it wasn't
Yeah,
that. So,
yeah,
so
obviously.
it wasn't like I was doing physical work, but yeah, I was back after
Yeah,
1 week.
yeah. So, and that summarizes exactly what the difference is when we do a minimal invasive surgery versus open old-fashioned surgery. Recovery, going back to work 2 months versus 1 week. Our blood loss for you was like 3 spoonfuls of blood. That's all what it is. It wasn't even half a cup of coffee. Our surgery was actually for you is about 30 minutes, half an hour.
I think you told me it was
Excuse
21 minutes.
Yeah, well, we had to, to take the
Whatever.
dressing off and so on. But half an hour, 21 minutes surgery for skin to skin versus hours of surgery. That certainly, in those hours that we do surgery, we are damaging the tissue, we are cooking the tissue, we're causing bleeding, we stop the bleeding. And certainly it makes sense that that's a longer recovery.
I think you had me up and walking. A nurse had me up and walking. It was about 2 hours after the surgery.
Yeah.
It was pretty quick.
And that is pretty usual for what we do.
Yeah.
Now, many of my colleagues, they concentrate too much on the pictures. But what matters is the outcome. This is 1 year out. You were a few days on narcotic.
Yeah.
You went walking days after the surgery, in 1 week back to surgery. In literally the 4 months or something like that, you achieved the goals of the surgery. Whereas after open surgery, it is usually not unusual to need at least 9 to 12 months to reach those milestones.
Even at the 4 months, I was getting better every day.
Yeah.
It wasn't like it was I could see
Yeah.
the progress, so I wasn't.
And and the point is that your outcome is nothing unusual for us. The patient that we do the surgery, so you are not even one of our best outcome, because our best outcomes, they don't need 4 months to achieve those milestones in your age group. But it still is a usual. It's what we call within what we call average outcome.
Part of that outcome, it might have taken me 4 months because I pressed things a lot.
Yeah.
I mean, like I
You
said,
said you're working out, right?
Yeah, I was working out. I was lifting weights. I was doing all that. So
When did you start working out? After
it was
surgery?
probably 2 months.
2 months.
Yeah, I felt pretty good.
Yeah.
You didn't put any restrictions on me at that time. You
Yeah.
said listen to your body, so I started lifting weights,
Yeah.
and that maybe that's part of it. I should have probably
No,
backed
no,
up a
but
little,
your
so.
body talks to you, and it did. So you know it.
Yep.
Well, thank you so much for this
Thank
interview.
you.
I really
Yes.
appreciate that,
Yep.
okay?
Yep.
Thank you.